is a step-by-step guide on how to order physical, occupational or speech therapy for a patient. We ideally try and arrange for therapy providers that are willing to travel to a patient's home, as a large number of our patients are elderly or are recovering from severe illness or injury, and some are also bedbound. In order to receive this type of therapy for a patient, the first step is to obtain a prescription from their doctor. This will ensure that their insurance pays for the therapy, because their doctor has requested it. Let's look at patient Deborah Mines. Navigate to the search bar at the top right of your Asana screen, and type in her name. If there is no PCP, short for primary care physician, listed on a patient's Asana card, you will then contact the patient and request their PCP details, as this is who you will be requesting a prescription from. You will need to have the patient's information ready when contacting their doctor, and you will find the required information in the patient's Asana card in the description box. You will need the patient's first and last name, their date of birth, home address, name of their insurance and their insurance ID number as well. You will also need their secondary insurance information if the patient has any. If a patient has requested physical or occupational therapy, you will request that their doctor fax over a prescription for PT or OT to us at 845-445-6785. We must have a copy of the prescription in the patient's file. Keep following up with the patient's doctor until the prescription has been received. Finding a physical and occupational therapy facility near the patient. Remember to always first look at preferred providers before searching in Google. In this case, we have already checked preferred providers and there are none situated locally to this patient. The first step is to go to maps.google.com. Next, type in the patient's address, which you will find in Asana on their board, and click Nearby. You will then type in physical therapy in the top left search box. This will then pull up the following list of physical therapy facilities and agencies: Megan Physical Therapy and Rehabilitation, Done Fit Physical Therapy, Progress Physical Therapy, Oni Orthopedics and Therapy, Optimal Physical Therapy Gym, LLC, Jesse L. Anderson, DPT. You will then contact each therapy facility, and ask the following questions. Do they accept the patient's insurance? What do they need to begin services with this patient? Most agencies require a prescription for physical or occupational therapy. How soon can they begin services? You are looking for a facility that accepts the patient's insurance, is close to the patient's location, can ideally carry out the therapy sessions in the patient's home, and has availability to start as soon as possible. You can also inform the facility of the patient's preferred dates and times. Here are some helpful tips to go through before contacting a therapy agency to set up an appointment with your patient. Always ask the patient for any dates and times they would like the therapy to take place. They may not always be able to get an appointment for their preferred time, but some facilities can be flexible. Ask the patient where they would prefer the services to take place, namely, at their home, virtually, at the therapy facility. You can also send an email request for PT or OT. Just make sure to include the following information: the patient's name, their date of birth, the patient's home address, our office number, at least 2 ICD-10 codes, the patient's primary and any secondary insurance names and ID numbers, the patient's doctor's information, including their name, phone and fax number. Always include our telephone number rather than the patient's, and ask the therapist to communicate with you and not the patient, until you have confirmed with the patient which facility or therapist they would like to use. Always attach the prescription to the email. Including all of this information speeds up the process. If you are unsure and have any questions, you can always ask the facility for clarification.